Hi everyone, good afternoon. I'm Sunan Fatima. I'm an account executive here at NowPow. I'm very excited to share with you a little bit about NowPow. And I'm going to start by sharing a little bit about our name and where we come from. Our name means knowledge is power. It's a play on words. And how we do that is by, are you able to hear me? Oh, great. Looks like I'm back. So how we do that is by powering up whole person care across whole communities. And we do that by looking at all of the SDOH needs. We want to make it very easy to share referrals for individuals with SDOH needs, chronic care, and for people who are already well. We want to be able to keep them well. And we really do this by having a high quality referral. This is what NowPow does very well. It's our hallmark. We do this because it's important to maintain the trust and provide the best quality of referrals for our individuals. We want to do this by using a combination of three features. We look at the best fit resources for your individual's the need, their abilities, and their preference. We look at how efficient it is for our users to use it. And with partnering with Redox makes it very easy to have a seamless workflow and provide it very easily and quickly using the information available. We also want to look at the success of the outcome by tracking if an individual has gone to the service, the outcome if it was successful, or if more intervention is needed. While we're doing this, we want to be sensitive to all the stakeholders in the community, the individual organizations as well as large networks. We can provide for ad hoc use for an individual community health worker that might be at a clinic, as well as a case manager who needs a very detailed integrated workflow at a health system. And we're really looking to capture data on all of this. And we want to power up communities in all sectors and sizes. And the value of collecting data and measuring outcomes allows us to evaluate the interventions, have decision making around the resource demand and supply, look into conversations around strategic partnerships, and understanding how to optimize workflows. And we do this at a variety of levels: the individual, the partner, the network, and the community levels. And a part of that is understanding not only how important it is to give a high quality referral, but to understand what really happened. We want to know if an individual has attended a service, if they were able to receive the service in a successful way. And our platform allows us to not only close the loop on care, but go beyond that and capture information on what it means to have a successful referral and an outcome. And all of the things that I've shared so far are grounded in science. Our whole person care solution comes out of Dr. Stacy Lindau's research on community-based referrals, and that was evaluated by a third party and showed value-based outcomes, like lowering readmission rates and lowering ED utilization that was unwarranted. What we're doing is grounded in science, and we believe in that data that we're constantly capturing is going to power up the decisions. I'm going to go into a little bit of detail around how our platform works. And these are the 5 steps. I don't have time to go through a full demo at this time. Feel free to connect afterwards. You'll see a slide with our information, and you can request a demo anytime, and I'll be happy to dive in and show you. So first, we want to use the existing information that might be an electronic health record, a case management system, to identify the needs, along with any screeners our clients have in place or ICD-9 and 10 codes that are pulled through. We use all of this information and we put it through our leveraging our algorithms and filters to find the best match services for our individuals. And I'll speak to that a little bit, and it goes back to how we get the best fit on our referrals. Now that we've provided the best fit resources for our individuals, we want to make it very easy to share with them. We allow for texting, emailing, and printing as a way of sharing resources. You can just share a resource, provide that information for an individual to go ahead and get to that resource on their own, or you can use a track and coordination function. This allows for you to have coordinated referrals where you're sending a referral, tracking closing the loop, and is that successful outcome, determining what means a successful outcome for that specific referral, as well as following up with the service provider. The platform also supports bidirectional messaging between not only the referral sender and the referral acceptor, but the patient as well. And this can be in the form of a reminder or even a form of letting the individual know they have an appointment coming up, or if they missed one, which drives down no-show rates, which can be a huge burden to community service providers as well. And you'll see underpinning all of that is our analytics. We go back to capturing analytics across the platform so that you can understand your population's needs and optimize the networks that you're building. By partnering with Redox, this allows for NowPow functionality to be embedded into the electronic health system and the case management system that you might be using. This gives a seamless experience for our users that's built right into their workflow. As you can see here, the bidirectional workflow of information on one side, it shows that we're collecting data, we're pulling in the data, we're applying our custom condition algorithms, matching them to resources, and then pushing back data to the electronic health system. So there's a two-way conversation happening there. And on the other side, we can see a view of what this would look like. This is the embedded view a user can enjoy, which makes it very easy and dovetailed right into their workflow and easy for them to provide it as a standard of care. We talked a little bit about personalizing to the individual. We do this by pulling in information that might come through an electronic health record in the form of an ICD code, a screener, or any other information in there. We run that through our 50+ custom condition algorithms, our matching logics, which allow us to create a personalized list of referrals that are best fit for that individual's language preference, location, or even eligibility. We have all of our resources in the directory that this is cross-checked against, which is highly maintained and checked for quality, and we build entire directories. About a third of our team does that. And when we talk about referrals, we really think about addressing it across the whole population health pyramid. You'll see at the top over here, we have the well. For individuals who are well, we want to keep them well. We want to provide them with the information that they need to stay well, take care of themselves, and stay out of the risk category. However, you might have some pre-risk or high-risk individuals that need some tracking. This is where you can send the referral, follow up with that referral, and keep tabs on how that person is doing. We want to prevent them from falling through the gaps without burdening care providers to track every single one. So those two levels really work together to address your well, your medium risk, and your high risk. For those highly complex individuals, those super utilizers, we have a coordinated networks that we set up in place that allow all stakeholders to be informed and on the same page with the individual's care. We have a platform that addresses not only the basic SDOH needs that might be of vital resources, food, housing, transportation, interpersonal violence, and some organizations have programs in place that we support. We go beyond that to look for things that might be like very specific to mom and baby or for substance abuse, and we support those interventions as well. And then we also look at the other side where we're thinking about chronic disease and managing that prevention or support for caregivers, managing conditions on your own, and acute conditions as well, like cancer. When individuals have a variety of needs that go beyond medical care in those situations, like finding respite care, medication, or home care. And then we also have the resources to link people to primary care services and just taking that first step to getting access to care right within their community. With all of this, we believe it's so important to capture deep analytics at those variety of levels, the individual, the partner, the network level. And we do that in those levels so that you have information on your referral success, on your network building. So you can have partnership discussions right within your community to see who you partner with, if you have certain needs that you didn't know your population is starting to show, and even at the policy level, if you find that an area has different supply and demand, like there's not a lot of food resources in an area, that might indicate a food desert and spark some change at a policy level. And some examples of how our clients are doing this, I'm going to share a little bit. We span across the states. We're working in Washington, California, Minnesota, Wisconsin, Illinois, and then I'm going to kind of walk you through that. So first, I'm going to feature a little bit about Allina Health. This really shows our ability to scale within a large system. And one key, this is a lot of numbers right here, but one key number I'm going to point out is the number of people that were screened for needs at the beginning of the year is just a little over 1,000. By the end of the year, 72,000 people were screened for needs. And not only did we take that first step in supporting them in screening for that, but we also help other clients use closed loop referrals. For example, in Children's Minnesota, they were able to use the closed loop referral platform functionality to increase food procurement from 20% to 80%, which is significant. This allows our care professionals to utilize what they have using the embedded experience and matching people to have driving outcomes. I also want to move a little bit further to the east and highlight our East Coast partnership. Very new, very exciting that we just came out with this press release. Feel free to email me and follow up, and I'll share that with you as well. We're going to be partnering up One City Health, which is an existing customer, but they'll be using our directory and our platform to match navigators and connect patients to the community resources that meet their identified needs. And finally, as we close out, and one thing I will speak to before I move through, those are just a few examples. We really power up different interventions in different areas across the states. We have a variety of clients. Some of them I didn't speak to due to time. We're working in the criminal justice. We're working in universities, in health systems, large and small, and clinics. Our area, our point of care can vary. We're here to support everyone and everyone's mission to provide care for their communities. I'm going to speak a little bit about ROI, and this seems like a lot of information, but I'm going to help and kind of just give you an idea that we're addressing the triple aim. And we're not just thinking about short-term outcomes. We're looking at intermediate outcomes and long-term. And I'm happy to speak to that and follow up anytime. And just to summarize everything and just bring everything back together, we are here to support multiple objectives, whether it's awareness, prevention, managing a chronic condition, having people get empowered to take care of themselves, or just have information on hand for when they need it. We not only look at those SDH core needs that have sparked this movement, but we're going beyond that for acute care and cancer, in chronic condition with diabetes, even wraparound service for mom and baby. We really think about all the needs an individual might have across all life stages and stages. And we have a variety of clients, as I just spoke to, that we might be working with people who are part of children and family type services, who work in helping seniors only, ACO members, uninsured individuals. And a lot of this is configured all the way into our platform by allowing users to match by this, to have services specific to seniors, children and family, uninsured, undocumented, and so on. And as I mentioned just a few seconds ago, we have a lot of delivery points. You can use this in a hospital setting. You can use this on the street. You can have community health workers go into communities to evaluate people for resources and connect them as well. And with that short summary, I'm going to go ahead and close out, but I will invite you to follow up by emailing us, requesting a demo, or even asking a question and follow up. Great.
Yeah, there is.
If there's any questions, feel free to ask them in the chat and I'll be addressing them.
Yeah, there is one question, so I'm going to post it in the chat. I don't think Sunan can hear me for whatever reason.
We had a great question coming in. How does NowPow keep track of the patients as they go through their care journey with these communities-based resources? How do you know a person has received the services, track the outcomes after the fact? That's a great question. We capture information on if an individual has received the service. So once you send a referral, the community-based organization can accept, deny, or waitlist it. Then go a step further to show if they contacted the patient, if they've made an appointment on behalf of the individual, and if they received a successful outcome. That varies from the types of services you may have. And a successful outcome for a food pantry might be accepting a package of food, whereas in a driver's ed class, it might be attending a class. You can customize in the platform what that successful information or successful outcome is. All of that information is captured on the CBO side as well as the provider side. And it's housed within the platform so you can view it anytime and track multiple needs or each referral at a time to see how your individual is doing through their care journey.